Hi, welcome to It Takes Guts. I'm your host, Stacy. I have been a GI nurse practitioner for the past 6 years. And prior to that, I worked as a nurse in the endoscopy department for 15 years. I love GI. Today, we're going to be talking a little bit about dysphagia. That is difficulty swallowing. We see people in the office for this pretty frequently. So if you are somebody here like, oh, I ate that hamburger and it kind of got hung up here, you are not in the minority and you're certainly not alone. There are different reasons for why food or fluid are difficult to go down the esophagus. The most common thing would be a stricture, which is a narrow area where at the bottom of the esophagus, it can be from reflux. Peptic strictures are what they're called, or a Schatzki's ring. Some people can have something called eosinophilic esophagitis. That is a very long word, and I did not make it up, but this is where you have a large number of eosinophils, which normally you shouldn't have in the esophageal lining. But this is like an allergic reaction to something that can cause difficulty swallowing. Some neuromuscular disorders, such as ALS, myasthenia gravis, people who've had strokes, have issues with the muscles in the esophagus. And one specific disorder is called achalasia, and that is where the esophageal muscles just don't really contract at all. Your esophagus, instead of, kind of helping move the food down, it just stays wide open. And then at the bottom of the esophagus, where it goes into the stomach, that little sphincter there is really tight and just won't relax. Some people can have something called esophageal spasms, where the esophagus at the very bottom, again, that little sphincter at the bottom going into the stomach, just does not relax a lot, or right near there becomes very tight and doesn't relax when you're swallowing food or fluid. People will usually have severe pain with that, and then eventually things will relax and go down. Sometimes eating too quickly can be a cause. And then something like a tumor or a cancer would be another more serious or scary sounding cause. So how do we diagnose these? One of the things that you can get done from your primary care provider or your GI would be a barium swallow study. This is done in the radiology department. You go in there and they give you some barium to swallow. It's a liquid. Sometimes they'll give you a barium tablet to follow up with. And what they do is, in front of the x-ray machine, you're drinking this stuff down, and they can actually see how it's going down the esophagus. They can see, is it contracting right? Is there a tumor? Is there a stricture or a narrowing? Is there some significant inflammation? They're able to see a lot. Another thing that we often order is an upper endoscopy or an EGD. That's where we give you some sedative through your IV, you're asleep, and we take a little scope with a light on the end and we pass it from the mouth, and we're able to look all the way down the esophagus into the stomach. One of the benefits of that is not only can we see, but we can go ahead and get biopsies if we need to, or do some other treatments while we're in there. Another study that is probably a miserable study, and I tell my patients when I order it, it's not fun. It is a mind over matter, but that's called an esophageal manometry study. And this is after you've had an upper endoscopy or a barium swallow study, and we don't see a stricture or a narrowing or anything we can treat right there. We're looking for a motility disorder like achalasia, or the esophagus just not contracting well. And this test, you're awake, and we take a very skinny little probe, and we go from the nose down the esophagus, and then we have you take sips of water or sips of saline, and we watch how the esophagus is actually contracting, and is the lower esophageal sphincter relaxing to let things go down. And that's a really good diagnostic tool also. So if we do find some of these things, how do we treat it? Well, like I said, sometimes reflux can contribute to things. If you are having reflux coming up into the esophagus, it can lead to esophageal spasms. It can lead to those strictures developing sometimes. So we put you on a medication to reduce the stomach acid. If we do see that you have a stricture or a narrowed area, we can actually treat that during the upper endoscopy. We can actually stretch it open. There's a few different ways we can do that. People get relief pretty quickly. You might have a little tenderness for a day or two right after we do it. It would feel like a bruise when you're swallowing, but people normally feel great right afterward. Sometimes you have to have it done again. Other people might never need it done again. There's not really a way I can say, oh, it's every 3 months or 2 years. Everybody's a little different. That's going to be based on your symptoms. If you have that long word, the eosinophilic esophagitis, we treat you with a medication. One of them is an anti-reflux medication like Prilosec or Nexium that is known to reduce the number of eosinophils. There are other medications that we can also use, like a little steroid that will actually help treat it also. And there's some newer medications coming out that they're looking at. If you have achalasia, which is the one where your esophagus is not contracting at all and then it's really narrowed down here, that is usually treated with surgery and people do remarkably well. If you're having esophageal spasms where the bottom of the esophagus is really spasming tight, there are medications we can give you that help relax the lower muscles in that esophagus that help it relax and allow food to go down. If you have one of the more significant motility disorders, if it's mild where you're like, oh, I feel like it's sometimes hard, but I'm still getting stuff down, that's dietary modification. How are you swallowing? So you take smaller bites, chew really well, alternate a bite of food with a sip of fluid, and you do that as long as you can. But for something like myasthenia gravis, or if you've had a stroke and you're not able to safely swallow food, the esophagus is just not contracting well, sometimes you need a feeding tube. If you do have a tumor, that would be getting you in to see a surgeon. Sometimes you might need a stent placed in the esophagus and we can do radiation therapy and then get you into surgery. And then again, every once in a while, if it's to a point where it's not operable, you might opt for a feeding tube. So this is really the overview of difficulty swallowing. So when would you want to seek help? If what symptoms would say, I probably need to go see somebody? Anytime you're having trouble swallowing, don't wait until you end up in the emergency room because you ate that piece of pork chop and it got stuck in your chest. You want to try to get it taken care of before then. So if you tend to eat normally and one day you're like, oh, things are really just feeling like they're slow to go down, or if at any point you do feel like things occasionally are getting hung up in your chest or you're having pain with swallowing, go see a healthcare provider, especially your GI provider. We would be more than happy to help find out what's going on and treat it. So please like and subscribe to the channel. Leave me some comments. Let me know some other topics you would like to hear about or discuss. And remember, I want you to be informed, educated, and know you're not alone. Thank you.